We begin today at 5 with news of another weapon in our arsenal in the fight against COVID-19. We now have the nation's first update to our COVID vaccines. The new booster is specifically designed to target today's newest Omicron strains. Those are BA.4, BA.5, and BA.6, and they are considered to be the most contagious COVID-19 vaccines yet, or virus yet. January Keaton has been looking into this story all day and has all the details.
The usual recipe for shots made by Pfizer and rival Moderna tweaked a little by the FDA. With this new vaccine, the hope is to stave off another winter surge of COVID infections. But the new vax is pretty much the old vax.
This is still the exact same vaccine. There's no difference in its chemical makeup. All they did was change the mRNA template.
The mRNA template is kind of like the instructions the vaccine gives to your body on how to fight bad proteins, like the spike protein found in Omicron variants. Until now, COVID-19 vaccines have targeted the original coronavirus strain, even as the virus kept mutating. These new boosters have half the original vaccine recipe and half protection against the newest, more contagious Omicron versions, BA.4, 5, and 6.
This vaccine will induce people who have been boosted with it to make antibodies not just against the current Omicron variant, the old parent variant, but other variants that maybe haven't even arisen yet.
Now, there is a small catch, though. The CDC will have to recommend who gets the new vaccine. The Senate cut COVID recovery money earlier this year, so the government was only able to purchase from Pfizer and Moderna about 170 million doses total of the new vaccine, which isn't enough to cover the nation's entire adult population.
Most people who are otherwise healthy, if they're vaccinated, even with the less effective, older vaccines, still have some protection from hospitalization and death. But there are some very vulnerable people who, even with vaccination, are having a bit of a hard time of it because they're more vulnerable to this virus. So that's going to be the population that the CDC is going to target first.
Now, that doesn't mean healthy folks can't get the new shot. They just won't be chosen first to get it. More vulnerable populations, sick folks, healthcare workers, seniors, etc., they'll get first dibs on the new shot. The updated boosters are only for people who've already had their primary vaccinations using the original vaccine. Pfizer's new booster will be available for folks 12 and up. Moderna's for adults only. The new vaccine should start going into arms around mid to late September.
All right, very good. About a month from now, January Keaton live from the 3 Newsroom. January, thank you.